Greetings and welcome to this edition of Berkeley Conversations COVID-19. I'm Dan Mogulof from UC Berkeley's Office of Communications and Public Affairs. Today we'll be talking with three leading Berkeley psychologists about effective approaches and strategies for dealing with the anxiety, stress, and uncertainty that have become inherent parts of the COVID-19 crisis. Professor Frank Worrell, Frank, is a faculty member at Berkeley's Graduate School of Education. He's an expert on the challenges of learning at home, the benefits of structure, and the sort of online resources that can best support learning and well-being. Sonia Bishop, who's joining us from Birmingham today in England, is an associate professor within the Department of Psychology and the Helen Neuroscience Institute. Among her areas of expertise are anxiety and decision-making under uncertainty. And Dr. Keltner is a professor of psychology and the co-director of the Greater Good Science Center. He's going to be talking about ideas and practices that can help us cultivate resilience and connection as we face the challenges of the coming months. I want to go around and just start by asking each of you, and it's something I think we're probably all asking each other, how are you doing and how are you coping? What's working for you right now in sort of the face of really an unprecedented situation? Frank, let me start with you.
I think things are going well. I mean, I'm accustomed. I live alone, so being alone is not unusual. Not being able to leave the house, of course, is a bit of a problem. I can't go to the gym, and I'm finding that I'm doing less writing because I'm spending so much time in front of my computer teaching and doing meetings that I don't want to sit down in front of the computer to write. On the other hand, I'm playing the piano a lot more. I hadn't touched it much this year, and I've done it practically every day in the last month. And actually reaching out to friends, not just in the United States, but around the world.
And what's working for you? What have you found? What have you found that's sort of helping you get through this moment in time?
Actually, music. I conduct choirs and stuff, and so music has been a great solace to me. I actually rewrote the words to Ain't Misbehaving to speak to COVID, and one of my friends is going to be performing it next week. So,
super. Sonia, let me come to you next. What's it been like for you? And as somebody who sort of has a specialty and a particular interest in anxiety, how are you applying what you know to what you need?
It's not been too bad so far. I'm sure, like many people, in some ways, once the shutdown kind of kicked in, to some extent that reduced a lot of the anxieties. For example, trying to persuade my mother to stop going to the gym, which had been a conversation up to that point. For me, myself, one of my main hobbies is improv comedy. And that community has been amazing and very rapidly moving to free online classes and jams. And so that's a lovely way to still find some time to relax and laugh during this. And then also family. We normally play board games at Christmas. And so we started doing a weekly online playing board games together.
Dacher, same question.
Yeah, it's been the best of times and the worst of times. You know, I really miss teaching students face-to-face and lab and grad students and everything that's part of university life. I miss it poignantly. I've been Zoom bombed, you know, and that's quite an experience. But then in terms of, you know, how we're adapting here, you know, my two college-age students are back in the home. And it's been really wonderful to have dinners together and try new recipes. Some go well, some do not. And then making sure I get outside and do social distance hiking all the time. So
Frank, let's get down to sort of kind of the nitty gritty. And I think a lot of people who are joining us today are really looking for tips and guidance in, you know, an era that nobody was really prepared for. In terms of our kids, what's important to keep in mind? What are some of the key things we can do to support their mental health and well-being?
I think there are several things. I think one is actually to keep our sense of anxiety away from them. So that when, you know, we are concerned, we don't want to show that to them that we are very distressed. But two, providing structure in a way that they've not had before. Typically the school day structures kids' lives. So they get up, they dress, they go to school, they have after school programs, they come home, they do homework. Now they're at home all the time, and if we do not put that structure in place, they are going to be sort of without an anchor. And so that structure is going to be really important for them to have a sense of predictability, competence, and going forward.
So, Sonia, I'm going to turn to you because part of what Frank's suggesting is that maybe a little bit of protection from our own anxiety. And as somebody who specializes in that area, how do we address our own anxiety? I mean, it's not, we don't want to be in denial. What's happening, it's clear what's happening around the world, and it seems rational to be anxious about it. So, how do you deal with that?
Absolutely. I mean, all of us have different levels of anxiety normally. And so some people will be very used to experiencing anxiety and it may be worse. For others, it may be for first time. We know from surveys that at the beginning of the outbreak, before there were stay-at-home orders, quite a lot of people were not necessarily feeling that anxious, maybe not taking it that seriously. I think for a lot of us, when we have rapidly changing situations like this, we're not used to, it can be very easy to have what we call optimism biases kick in and to feel vulnerable, particularly if it's not a simple thing to imagine. But now we have more images coming on the media. Many more people are seeing people who are like them getting ill. And so I think a lot of people are experiencing anxiety. Some surveys say 6 out of 10 adults. And so really in that situation, we need to try and find things that help us relax and be gentle to ourselves, maybe not expect so much of ourselves if we're still working remotely, and try and be healthy, maybe not watch the news too much if that's a negative for us, maybe once a day, not before we go to sleep, and definitely keep exercising and eating healthily.
So, part of your answer, it seems to suggest that there's going to be a great variance in terms of how individuals deal with anxiety and deal with the moment. And that may even be happening within family groups. What's behind that? Talk to us a little bit more about that phenomenon.
Yeah. So one of the issues is that we're not very good about making judgments under uncertainty. And this situation is just a kind of perfect combination of things to make it very difficult for us. So at the beginning, there's a lot of information missing. We didn't know how long perhaps it had been spreading in the community, how many people were infected. And then rates were changing very rapidly. And so that means it's very hard to have precise estimates. And in that situation, some people will assume for best, and other people will assume for worst. And we also know that it's actually normally quite healthy to have an optimism bias and to assume, you know, really bad things won't happen to us. You know, we won't be someone on a plane which crashes. When those things happen infrequently, that's a good strategy. But in this situation, initially what the government really needed was everyone to take it more seriously. But the counter side of that is as people do start getting ill, or we maybe know people who are sick, then people will become more anxious and it will really hit home. And that's where we need to protect people from anxiety and potentially depression as well.
So, Dacher, I know that both you and Sonia study the neurophysiology of stress, and I know you also do research on positive emotion. Share a bit of what you know about those areas and how it relates to this discussion we're having in this moment in time.
Well, you know, Sonia's comments about the 6 out of 10 people feeling anxious right now, that's really worrisome. We know from past quarantines that people show a rise of PTSD and depressive symptoms and anxiety, often like threefold rises. And what we know about the neurophysiology is it activates parts of the brain that Sonia studies, like the amygdala, gets into your HPA axis, the hypothalamic pituitary adrenal axis, cortisol rises. And a lot of trouble can ensue if we have chronic anxiety. And this is just a recipe for chronic anxiety. And so what I would encourage our listeners to do, also mindful of Sonia's point that we're all going to adapt to this in different ways, right? We all have our strengths and our weaknesses. At the Greater Good Science Center, greatergood.berkeley.edu, we've put together a lot of resources that can help us adapt. Things like maybe start practicing a little bit of gratitude. What in the day do we feel grateful for? Not whatever our circumstances. You know, getting outside, turning to music, like Frank said. There are nice data showing a little bit of listening to music kind of calms the body down very profoundly and directly. So I think we have to really up our game in terms of building a set of practices. And in a way, it's an ideal time to handle this chronic anxiety.
So, Dacher, I know you also talk about, think about, write about, research about social connection and the important role that social connections play. And it feels like something we need more than ever is harder to achieve than ever. How do you balance that? How can you find some of that, some of the goodness that comes out of social connections and use it to your benefit in times like this?
Well, I think that, first, there's a sense that we're going to be in these pods for a while. So, amp up the connection in those pods, return to unstructured conversations. I think, as Sonia said, there's a lot of invention going on online. So interesting to hear about stand-up comedy or improv doing it. I have a friend who leads a worldwide dance organization doing a lot of online dancing, which is remarkable. And then I think we're going to need really accurate information, right? Just when can you connect with people? And that one part will be the responsibility of CDC, right? To guide us in this, because we know, one of the biggest findings in the happiness literature is strong connections give you 10 years of life expectancy. And that is in jeopardy right now, right? So we need intelligence on this.
Interesting. So, Frank, one of the things that Dacher just talked about is adaptability. And I think in other times we tend to think that kids are sort of inherently adaptable, but maybe that's not the case right now. Are there differences, do you think, that can be generalized about how different age groups in terms of children are dealing with this and what we should expect about their adaptability?
Yeah, I think we're going to see things at different levels, again, with individual differences. So for young children, for toddlers and so forth, this is going to be an unusual time for them, but it's something that they are going to adapt to relatively easily, especially unless the adults around them are very anxious and communicating anxiety. So for school-aged kids, sort of kindergarten up to sort of early the early teenage years, I think this might pose some more challenges for them. Parents need to be more structured with them and give them space to do stuff, but structure their day. Because they are going to be understanding something is going on, but not yet be consumers of the news in the way, adolescents, late teenagers are. And for teenagers and so forth, you may need, especially if they're very anxious, to monitor their consumption of the news in a way that you have not, but allowing them to set the tone for themselves as they work through these things. So really, the middle years are perhaps the ones that need to pay more attention to. And Sonia talked about not watching the news before bed, having a check-in with children at the beginning of the day and at the end of the day, just to check in, so how things are going. Things like reading stories, playing games together, setting up a bedtime routine that allows them to go to bed in a calm and happy frame of mind, I think would make a big difference.
Frank, I want to ask you, I'm going to follow up, and I'm going to ask Dacher and Sonia to weigh in on this one as well from your own perspectives and areas of expertise. How concerned should we be as parents about long-lasting traumatic effects of what's happening right now and being cut off from traditional modes of learning? Or is this something that it would be legitimate to think will be transient and at some point it'll all wash out in the future? And because I think it's something we're all, for those of us who are parents, very concerned about that fact, about that lasting impact. What do you have to say about that?
Yeah, so one of the things that we know is that there's a range of individual differences. So we know that there are kids who, in fact, who may get classified in school as gifted and talented. There are students who actually may get classified as having a learning disability and so forth. I think that there are going to be differential impacts. For students who are classified gifted and talented, typically what that means is that they can learn faster than others. So that, in fact, when school gets back to normal, and sometimes even now, because they're often ahead of their peers anyway, they're going to do fine. We need to be a bit more concerned for students who have learning disabilities and so forth, where they're not getting, for instance, special education in school, so they're not getting the traditional learning supports that they would get. There are a number of places online, Khan Academy, PBS Kids, and so forth, that are providing those, information that can help parents in doing that. But parents may not have the time, and even if they have the time, they may not have the know-how to do this as well as somebody who's trained in special education. That being said, I think that over the longer term, you know, if this does not go on for like into the next year or something like that, I think the impact on learning is, you know, there'll be a dip, much like there's a summer learning loss, but this will pick back up when schools get back into session. And one potential benefit of this is that I think we are learning much more about online learning now. And so those lessons that we are learning now, we can take with us into the future when we are back in schools.
Nice. Dacher, long-term impacts. I'm wondering what you're thinking about from your area of expertise for ourselves, but really even more importantly for our kids.
Yeah, you know, I mean, I think first of all, there's a lot of work in the trauma literature, for example, by George Bonanno, that, you know, a lot of people are resilient, as Frank said earlier, and they will rise. But I am profoundly worried about what we call the health disparities, or just the disparities literature, that these kind of very disruptive cultural events affect the poorest, the lower class, people of color, the disenfranchised more. And that is almost a law-like proposition about how things affect human societies and by implication our kids. So we're starting to see data of this is hitting people of color harder, it's hitting the poor harder. It's probably going to be worse in context of economic inequality. And then when you know, Frank just conveyed a finding to me recently. Our poor kids, 40% of them don't have laptops, right? We're trying to work with Brownsville, New York City, and 40% do not have laptops. I do not know how you will do online education on a smartphone in a very crowded situation. So I'm really worried that this will bring a sharp focus on the weakness of US culture, which is racism and classism.
Wow. Sonia, how are you thinking about long-term consequences and possible impacts of this, particularly for our kids?
Yeah, I worry about some of the younger kids, in particular with regards to post-traumatic stress and anxiety. And we know some factors there. So we know if any children are unlucky enough to have a close family member get very sick or potentially die, that could be very traumatizing for them. Seeing their parents seem anxious, any indication that things aren't under their control, aren't safe, suddenly being exposed to that for the first time can be very anxiety provoking. And we know that a lot of anxiety disorders do set on in kind of late childhood or early teens. So as far as possible, protecting children from parental anxiety is amazing. But as Dacher said, that may vary depending on if parents are anxious about having to go out to work at this time, depending, you know, that will vary with socioeconomic status. It will vary with the kinds of jobs people are in. If children have parents who are frontline health workers, that will be extremely stressful for their parents. So there will be a lot of children who will be having kind of tough times right now.
So, Sonia, I'm going to stick with you here for a second. So, you know, speaking of healthcare workers, you know, there have been initial scientific reports that are suggesting that some of the frontline hospital workers in China, and Wuhan in particular, have experienced high levels of mental health problems, anxiety, depression, insomnia. Can you tell us a little bit more about that and how this is all likely to impact those people that are out there on the front lines every day who we depend on now more than ever?
Absolutely. So it's looking very concerning. We already know that situations like this can lead to high levels of anxiety, depression, post-traumatic stress. We've learned from situations like 9/11, which was different, but was very traumatic for frontline responders. And basically what we're seeing is, for example, in Wuhan, those who are involved with diagnosis and treatment of patients with COVID, who are witnessing patients dying, who are maybe feeling out of control, not being able to have enough resources for patients, not having enough protective gear for themselves. These are kind of the classic, unfortunately, perfect storm that can give rise to post-traumatic stress. And in Wuhan, as many as 1 in 3 frontline workers were reporting very high anxiety levels, and 1 in 6 were reporting the level of post-traumatic stress you might see after exposure to combat-related trauma.
Wow. again, we're coming back to some common themes here. Not surprisingly, I think we're feeling it in our personal lives, reading about it in the paper, the idea of anxiety, stress, and all the rest. And Dacher, I'm curious about something. I know in a lot of your work, you talk about the need to facilitate empowerment. Is that something that we can use to help address, mitigate, ameliorate the impact of stress and anxiety? And how exactly does that work?
Yeah, I mean, I think that's a theme running through our comments, right? That I think our audience and ourselves and our children should be thinking about what is an agentic approach to how I understand this mystery of COVID-19. It's still not understood in fundamental ways. And as Frank said, we should be thinking about empowering ways to handle the onslaught of information. I think what I always tell people coming out of the science of happiness, thousands of studies, peer review, is pick 3 or 4 things that you really can count on. Like Sonia was talking about improv through this pandemic. So that's empowering. And then I think that we need to really think broadly about how we turn to our imagination to empower new approaches to this. I just have to say, I've done research on awe, and awe reduces stress, reduces cardiovascular physiology, reduces the inflammation response in your body. And up at North Bay Community Health, Michael Amster, an MD, is putting in an awe program hospital-wide, right? Which is a way, as Sonia said, these frontline healthcare providers are really at risk. They are stressed out, their families are stressed, and he is putting in a way to get nurses and doctors to share inspiring moments of awe during this work, just to countervail stress. So I think empowerment's going to be, we can't let this run our lives. We have to find our agency.
So can you make that a little more concrete? I'm sitting at home listening to you, and I'd like to feel some awe. I'd like to feel some agency. I'd like to let my imagination run a little wild. Is there, and I'm sure people will be coming to the Greater Good Science Center to sort of follow up, but just right in the here and now, give us a little bit of guidance in that regard. How do we create awe?
Yeah. So well, first of all, we, as Frank said, part of the key here is structure. We are patterned animals. We love pattern story time. So I would pick 3 or 4 times during the day where you go after a little bit of awe through music, or just looking at the outdoors, picking a sunset, looking at a cloud, tapping into somebody who really inspires you, right? Martin Luther King or Gandhi. But I would go to ggia.berkeley.edu. It's all free. We've spent 5 years, a really talented team at Greater Good, to give people those very brief microdoses of awe, just to build it into their lives at this moment.
So Frank, we're turning, this is great to have what is really a utilitarian conversation, because we're all looking for tools right now because the regular toolbox seems to be empty. I know one of your areas of expertise is online resources. Tell us a little bit about, maybe if you can extract some things, either particular websites or some guidance about how we can do triage, separate the good from the bad in terms of the online environment, to find the resources that can help ourselves and our children.
Right. Yeah, I think actually if we go, so for instance, in the psychology space, we have, like, of course, the Greater Good Science Center that Dacher mentioned, but we have the American Psychological Association has been triaging a lot of information on its website. There are 54 divisions of APA, all of which have been asked to put together things that in fact help. There's the Association for Psychological Science and the National Association of School Psychologists. So what happens is that these national associations, where they can put evidence-based practices on their websites, are places you can go for psychological stuff. We have actually added on the announcement on the news page of the Graduate School of Education today, we've added about a 3-page list of triage things about parenting care and so forth. And then there are some well-known, I mentioned Khan Academy and PBS Kids, but Sesame Street, the Children's Television Workshop, ABC Mouse. There are a number of these places that are, some of which used to be charging for them, but they're now providing free resources, academic resources for parents. And if I could add a little bit more just related to what Dacher was saying, I know one of the things he studied, we talked about awe, one of the things he talked about is gratitude. I've done research on what we call attitudes towards time. And so one of the things that parents and kids can do is think back to happy moments. What we know is a positive past, positive present, and positive future. But having that sort of a profile actually reduces anxiety, it decreases stress, and all of those kinds of things. And so what are things that you can do after this is over? You can't predict when it's going to end, but you can predict what you will do after it ends. That's another way of getting a sense of agency, as Dacher was talking about.
So we only have a few minutes left, unfortunately, but I want to quickly ask each of you, because you've given us news we can use, information we can put to good use in our lives. What are you learning? What are you studying right now, Sonia, in this incredible moment in time?
Yeah, so right now, we just launched yesterday a new study to try and address this. This can be found on our website, which is bishoplab.berkeley.edu. And what we're doing is we're asking people, as many people as are willing, to take part. And we're going to track anxiety and depression, worry, and behaviors across the next 3 months. And what we're really trying to understand is how those are varying, because even though we think we understand it, really this is an unprecedented situation. And so it may be that some people are feeling really anxious right now and some people aren't. It may be that changes depending on what happens in our lives, economically, financially, in terms of our family's health. It may depend on the kind of behaviors we engage in. And if we can try and learn from that and see, actually, maybe there's some protective things that people who are relaxing in certain ways or engaging in certain ways are handling it better, we can use that information. Equally well, if we discover that a very large number of people are moving, say, from anxiety to depression, that's really important information we need to have. And then also for individuals, we provide links where they can
have a special interest in music and in creativity and writing and new forms of social connection. And then once you embed that within a hospital environment, you can start to look at how do these things help our health, right? Which is, we're in a very vulnerable moment health-wise when we think about rising levels of stress. So we're trying to make the most of this.
Frank?
Right. So in school psychology, we have a couple of things going on. One of my colleagues who specializes in bullying is looking at the impacts of bullying for Asian kids and so forth. And in fact, doing some collaborative work in China as well to look at the impacts of bullying and then the long-term impacts of stress on adolescents in this situation, and Wuhan being the epicenter, and with all of the statements that were being made about that. One of my areas of work is gifted and talented education, and we have a summer program at UC Berkeley called the Academic Talent Development Program. This summer, we're going to be online, which is going to allow us to, in fact, do our usual end of program survey, but look at how effective are the teachers in terms of clarity and enthusiasm, in fact. What are the things that the students are finding most useful and less useful, and so that we get a better sense. And these are kids who do well in school anyway. So this is a nice way to see, to compare with the past and then future summers.
Great. All right. Last question for all of you. I mean, one of the things that I've noticed, at least among my friends and family, is there's this yearning for a silver lining, this hope that so many people have that we'll come out of this better as a society, better as individuals. We may not take things for granted as much. We may be more aware of inequities. So I want to ask each of you, is that a form of denial, or do you think there's some legitimate hope on either a personal and or societal level that there's going to be some long-term benefit from this? Sonia, let me start with you.
I think it's definitely leading people to ask a lot more questions, to sort of stop and reflect on what's important, which relationships are important. Societally, I really hope so, but I think that one's more challenging. One thing we can do, which I didn't get time to mention earlier, was if people are able financially, even a small amount, one of the times we stop feeling anxious is when we think about others. So something we can do with our kids is to look at ways of giving, perhaps in third world countries where they have less resources to handle COVID. So this can be a great time to actually sort of teach altruism or teach reaching out and maybe influence the next generation in thinking more about that.
Frank, do you see a benefit? Do you see a potential for benefit in a better day?
Yeah, I do. I do think, I mean, we know that in fact, in moments of challenge, hurricanes and so forth, that people come together. We also have the people who do gouging, but one of the things that this is doing, because it's so widespread, but still also having those disparate impacts, I think it provides, as Sonia was saying, an opportunity for us to talk about, for instance, a living wage for everybody, health care for everybody, and many of those things which we would all want for ourselves and for our whole society. And I think that the importance of those things at a societal level have been made manifest very much in this moment.
Dacher, I'm going to give you the last word.
Thank you. Yeah, you know, I mean, after the Black Plague, 14th century, cities got cleaner. They stopped using lead, and there was more, there was less serfdom. So we moved out of this system of indentureship. And I think, as Frank said, you know, this pandemic is revealing the things we need to work on as a culture, and I'm very encouraged. But I think we got a lot of hardship coming. But I'm encouraged about the conversation around poverty and inequity and race and how we fix that. So it's the central thing we're facing.
And for my part, I have to say I'm encouraged to know that there's folks like you, not just in psychology, but across the campus that are engaging all of these issues at the moment. I really want to thank all of you for what's been an incredibly informative and interesting session. And for those who are watching, for more information about this, if you go to news.berkeley.edu, there'll be a write-up of this event. There'll be links to some of the resources we've talked about. Dacher's got a video series that he's recently launched. And I know, Sonia, your lab has things that are on hand for people who are looking for additional tools, and Frank, for you as well. And I ask that everybody continue to check the Berkeley Conversations webpage for new events that we're continually adding. And in the meantime, be well, stay safe, and by all means, keep your distance. Thank you.
Thank you.
Thank you.
Thank you very much. Bye-bye.